Hi everyone. So today we'll continue with the part 2 of the bones of the skull. We'll discuss the bones of the skull, the part 2. So in the previous video, we looked at the different aspects of the skull. We looked at the different angles of the skull. We looked at the normal frontalis, the anterior aspect of the skull. Then we looked at the normal occipitalis, viewing the skull from the back. Then we also looked at the normal verticalis, viewing the skull from above. So if you haven't watched that video, I encourage you to do so and kindly subscribe to this channel. So today we'll discuss another view, which is looking at the skull from the side. That's the normal lateralis. We'll look at that. Now we said that if we are looking at the angles of the skull, we look at four things. We identify the bones, number one. Number two, we identify the sutures. Number three, we identify the landmark. And number four, we identify the foramina, if there's any. So we'll look at the bones of the skull, viewing it from the side. All right, so this is the frontal bone, this is the parietal bone, this is the occipital bone, this is the zygomatic bone, and this is the zygomatic arc. Okay, this bone here is the greater wing of the sphenoid, and we have the squamous part of the temporal bone, and then we have the mastoid process, and then there's another process called the styloid process. Okay, and then for the bones of the face, we have the nasal bone where my cursor is, and then where my cursor is the maxilla bone. Okay, then this is the ramus. This is the ramus of the mandible. If you take away the ramus of the mandible, deep within it, okay, you have an infratemporal fossa. All right, so this is the infratemporal fossa. Then we also have another fossa called the pterygopalatine fossa. This is it, pterygopalatine fossa. And then lastly, we have a fissure. Okay, pterygomaxillary fissure. This is the fissure. All right, so all these structures are buried deep within the ramus of the mandible. So if you take away the ramus of the mandible, again you have an infratemporal fossa, then you have a pterygopalatine fossa here, and then a fissure which is called the pterygomaxillary fissure. Again, let's look at the bones. We have the frontal bone, we have the parietal bone, we have the occipital bone. Okay, we have the greater wing of the sphenoid, we have the squamous part of the temporal bone, this is the mastoid process, and this is the styloid process. This is the zygomatic bone, this is the zygomatic arc. Then we have the nasal bone, and then the maxillar bone. All right, so now we identify the sutures. The first suture we identify is the coronal suture. We said the coronal suture, okay, this is the coronal suture. Okay, it's found between the frontal bone and the parietal bone. Then we look at the lambdoid suture. Lambdoid suture is between the parietal bone and the occipital bone. So this is the suture. This is the lambdoid suture. Then we look at the squamous suture. It's found between the parietal and the temporal. So this is the parietal, and this is the temporal. So this suture here is called the squamous suture. This suture here is called the squamous suture. And then we look at the occipitomastoid suture, found between the occipital bone and then the mastoid process. So this suture here is the occipitomastoid suture. And then if you look closely, there's a foramen here called the mastoid foramen. All right, then we look at the parietomastoid suture. Okay, so this is the parietal bone, and this is the mastoid process. So this is the parietomastoid suture, and then we look at the frontozygomatic suture. Okay, so this is the frontal bone, this is the zygomatic bone. So this suture here is the frontozygomatic suture. Okay, so now we identify the bony landmarks. Okay, the first one we identify is the pterion. The pterion is a very important anatomical landmark. All right, this is the pterion. The pterion is an H-shaped suture. Okay, so please follow my cursor. Okay, follow down here. Okay, and then another one here. Now the pterion is in this region. This is where the pterion is. The pterion is in this region. So you can see that the shape looks like H. This is where the pterion is. All right, now the pterion is formed by four different bones, 4 different bones: the frontal bone, the greater wing of the sphenoid, the parietal bone, and then the squamous part of the temporal bone. Again, the pterion is formed by 4 different bones: the frontal bone, the greater wing of the sphenoid, the squamous part of the temporal bone, and then the parietal bone. Now, the pterion is represented in the infant skull as the anterolateral fontanelle. Okay, so this is the anterolateral fontanelle. Okay, so the pterion is represented in the infant skull by the anterolateral fontanelle, and this fontanelle ossifies at the age of 3 months. At the age of 3 months. Now, what is the clinical importance of the pterion? The clinical importance of the pterion. Now, the pterion overlines a very important blood vessel, which is the anterior branch of the middle meningeal artery. So, when you have a fracture of the pterion, fracture of the pterion can injure the blood vessel, which is the anterior branch of the middle meningeal artery, to cause an epidural hematoma. Again, what is the clinical significance of the pterion? The pterion underlines a very important blood vessel called the anterior branch of the middle meningeal artery. Once the pterion is fractured, the blood vessel can be injured, which can lead to an epidural hematoma. Now, another landmark we'll look at is the asterion. The asterion is formed by 3 bones. Okay, this is where the asterion is. This is where the asterion is. Okay, so where my cursor is, it's formed by the parietal bone, it's formed by the mastoid process, and it's formed by the occipital bone. Now, the pterion is the site. Okay, it's represented in the infant skull. Okay, as the posterolateral fontanelle. All right. Now, what is the clinical significance of the pterion? The pterion lies opposite. Okay, the asterion. It lies opposite to the sigmoid sinus. Again, the pterion is another important bony landmark. Okay, when viewing the skull from the side, we said that the asterion is made up of 3 bones. The asterion is made up of the parietal bone, it's made up of the mastoid process, and then the occipital bone. We said that the asterion clinically lies opposite to the sigmoid sinus, and we said that the asterion is represented in the infant skull as the posterolateral fontanelle, and then the posterolateral fontanelle also ossifies at the age of 3 months. Then we'll look at another bony landmark. Okay, the superior and the inferior temporal lines. So these lines here, this is the superior temporal line. Okay, this is the inferior temporal line. Okay, this is the superior temporal line, this is the inferior temporal line. Now, the superior temporal line continues as the supramastoid crest. So this is the supramastoid crest, the superior temporal line, right? Then now we have the external auditory meatus. Okay, this is where the external auditory meatus is. Okay, where my cursor is. It's where we have the external auditory meatus. Now, just above the external auditory meatus here is a triangle called the suprameatal triangle. The suprameatal triangle. Okay, it is found below the supramastoid crest and above the external auditory meatus. Now, clinically, the suprameatal triangle forms the lateral wall of the antrum of the mastoid bone. It forms the lateral wall of the mastoid antrum. Okay, now we have the articular tubercle. Okay, so this is the articular tubercle where my cursor is. This is the articular tubercle. Very, very important tubercle because it prevents the head. This is the head of the mandible. It prevents the head of the mandible from dislodging. Okay, this is the mandibular fossa. Okay, so this whole thing is the TMJ joint, the temporal mandibular joint. Okay, so this is the mandibular fossa. This is the head of the mandible. Okay, helps for articulation. The fossa helps for articulation. So the tubercle, the articular tubercle, prevents the head of the mandible from dislodging. Okay, then now look at 5 structures that are attached to the styloid process. So this is the styloid process. It has 5 structures attached to it. The first, we have the 3 muscles and then 2 ligaments. We have 3 muscles and then 2 ligaments. The first muscle is the stylohyoid muscle, okay, which is attached to the hyoid bone. stylohyoid muscle attached to the hyoid bone. Then we have the styloglossus muscle attached to the tongue, and then we have the stylopharyngeus muscle attached to the pharynx. Okay, now the stylohyoid muscle is supplied by cranial nerve 7, okay, the facial nerve. The styloglossus muscle is supplied by the 12th cranial nerve, the hypoglossus muscle, sorry, the hypoglossus nerve. Okay, and then the hypoglossal nerve. Okay, then the stylopharyngeus muscle is supplied by the 9th cranial nerve, which is the glossopharyngeal. All right, now the stylohyoid muscle is supplied by the 7th cranial nerve because it is derived from the 2nd pharyngeal arch. The styloglossus muscle is supplied by the 12th cranial nerve, the hypoglossal nerve, because it is derived from the occipital myotome. And then the stylopharyngeus muscle is supplied by the 9th cranial nerve, which is the glossopharyngeal nerve, because it is derived from the 3rd pharyngeal arch. Now, also attached to the styloid process are 2 ligaments, the stylohyoid ligament and then the stylomandibular ligament. So again, we've looked at the bony landmarks, then structures attached to the styloid process. Okay, we looked at a very important bony landmark here called the pterion. We said the pterion is made up of 4 bones: the frontal bone, the parietal bone, the greater wing of the sphenoid, and the squamous part of the temporal bone. Okay, we said that the pterion, okay, is an H-shaped suture which is represented in the infant skull as the anterolateral fontanelle. We said the fontanelle ossifies at the age of 3 months, and we said clinically the pterion is overlines a certain blood vessel, certain important blood vessel called the anterior branch of the middle meningeal artery, and fracture of the pterion can affect this blood vessel, which can cause epidural hematoma. Then we looked at another bony landmark, which is the asterion. The asterion is made up of 3 bones: the parietal bone, the mastoid process, and the occipital bone. We said that the asterion is represented in the infant skull as the posterolateral fontanelle, which also ossifies at the age of 3 months. We said the asterion, okay, lies opposite to the sigmoid sinus. Then we looked at the superior and the inferior temporal lines. So this is the superior temporal line, this is the inferior temporal line. We said that the superior temporal line will continue as the supramastoid crest. Then we looked at the external auditory meatus. Then above the external auditory meatus is a triangle called the suprameatal triangle. We said clinically it forms the lateral border of the mastoid antrum. Then we looked at the articular tubercle, which prevents the head of the mandible from dislodging. Okay. Then we looked at the muscles attached, 3 muscles attached to the styloid process: the stylohyoid muscle, styloglossus muscle, and the stylopharyngeus muscle, and also 2 ligaments, the stylohyoid ligament and then the stylomandibular ligament. Okay, again, just to recapitulate, okay, this is the frontal bone, this is the parietal bone, this is the occipital bone, this is the squamous part of the temporal bone, this is the greater wing of the sphenoid, this is the zygomatic bone, this is the zygomatic arch. Okay, this is the mastoid process, this is the styloid process. All right, this is the mandible, this is the nasal bone. Then we look at the sutures. So this is the coronal suture between the frontal and then the parietal bone. Then we look at the lambdoid suture between the parietal and then the occipital bone. Then we looked at a very important bony landmark, the asterion, okay, which is made up of 3 bones: the parietal bone, occipital bone, and then the mastoid process. Then we looked at the pterion, which is made up of 4 bones: the frontal bone, parietal bone, greater wing of the sphenoid, and then the squamous part of the temporal bone. Okay. Now, what are the fontanelles of the newborn skull and their location in the adult skull? So we'll look at the fontanelles in the infant and their representation in the adult skull. So there are 4 fontanelles. The anterior fontanelle, okay, found between the frontal and the parietal bones. Okay, when you go to the adult skull, it is the bregma. And we said that the ossification of the anterior fontanelle is at the age of 18 months. Then the posterior fontanelle is found between the parietal and then the occipital bones. Okay, it is represented in the adult skull as the lambda. Okay, the ossification of the posterior fontanelle is by 6 months. Then we looked at the anterolateral fontanelle, which is found between the frontal, parietal, greater wing of the sphenoid, and then the temporal bones, okay, where we have the pterion. Now the anterolateral fontanelle is represented in the adult skull as the pterion, okay, and the anterolateral fontanelle ossifies at the age of 3 months. Then we have the posterolateral fontanelle found between the parietal, the temporal, and then the occipital bones, okay. Now its representation in the adult skull is the asterion, all right, and we said that the posterolateral fontanelle ossifies at the age of 3 months. Okay, so this is the anterior fontanelle, this is the anterior fontanelle, this is the posterior fontanelle, okay. Its representation in the adults is the bregma, its representation, okay, the posterior fontanelle is the lambda. Then this is the anterolateral fontanelle, okay, in the adult is the pterion, and then this is the posterolateral fontanelle, in the adult is the asterion. Okay, so for the base of the skull or the normal basalis, it will be discussed in a different video. If you've learned a thing or two from this video, kindly like, share, and then subscribe. I'll see you in the next video.